seems like almost everyone is trying to lose weight. You want to do it fast. You want it to be easy. Today we have Dr. Jardine from Springhill Medical Center, and he is going to give us some of the right ways and wrong ways when we are going about losing weight. Thank you for being here.
Thank you for having me.
Okay, so as we all know, it's very easy to get weight loss pills over the counter these days. So let's talk about that a little bit. There are some side effects to things like that.
That's correct.
All right, what kind of things do people need to think about when they're going and they reach for that pill, those pills at whatever store they're going to? What do they need to think about?
Well, I think that we provide a physician-supervised weight loss program in which the doctor would screen your medical history and your health history, do an EKG, et cetera, before giving a prescription appetite suppressant. And over-the-counter medication can sometimes be dangerous and have unnecessary interaction with something a patient may be on or some unique part of their medical history.
So you just don't know. So that's one dangerous thing.
Correct.
Okay, so what is the right way? Once we consult with our physician, give us some correct ways to lose weight.
Well, we provide a physician-supervised weight loss program. The patient comes in, is weighed on a special scale that determines a lean body mass and a fat percent, and it helps us calculate a caloric need. And then we counsel them about some appetite measures that we change their diet. We recommend a high-protein, low-carbohydrate diet. We encourage exercise, to what degree they can increase their activity, and other lifestyle changes. They need to drink plenty of water, and we actually prescribe certain supplements that include necessary vitamins, omega-3, calcium supplements. Our program does use a prescription appetite suppressant, but before we prescribe that, we do an EKG, we do a thyroid profile, we check their cholesterol, and there are certain parameters of how much weight they need to lose that they have to meet before we prescribe these.
Prescription or non-prescription, can you lose weight by just taking pills?
Actually, pills are just an adjuvant to what we're doing. The pills are a tool we use to help people with their cravings for perhaps their bad choices, their carbohydrates, their sweets, their snacks. The pills give you energy. They don't necessarily burn calories. Weight loss is still about calories in, calories out. You need to try to find a healthy balance of your food intake versus the food that you need to be eating. And there's so much bad food out there in our diet. I think it's terrible when you think about the advertising budget of people that sell fast food versus the people that sell you apples or healthy salmon. And the patients are swayed. One common thing when you go to buy salad dressing and you see the word fat-free, that makes you think this is a good choice if you need to lose weight. And actually you should run because that's full of sugar. And it was probably the worst choice you could have made.
So if it doesn't have one thing, it's going to have the other to substitute.
Correct. And so we've got to help people to fight their cravings and learn how many calories that are in the food they intake. We try to teach them how to read food labels, and we try to teach them to realize the right balance of protein and fat and carbohydrate necessary for them. Our program, the physician and our counselors will customize a program for each patient based on their caloric need, their ability to increase their level of activity, and what their needs are to how much weight they want to lose.
So in general, there's not a magic weight loss pill. It's just there are a lot of things that you need to take into account, right? Many
things. And that's why we advocate using a physician-supervised program such as ours that has more structure. You come in regularly. You have accountability for what you ate that week. We encourage people to keep a food diary. Again, they're weighed on this special scale that would show an individual who's doing the right things may turn fat into muscle, and they may be frustrated with their bathroom scale at home, and they're perhaps not patient enough that their skinny jeans are fitting soon enough, and we're able to encourage them to stay with the program. And when people don't make the right choices, it shows up very quickly when they didn't lose weight the next week. And if we're prescribing a prescription appetite suppressant, we make them accountable for their behavior, and they're confronted and perhaps not given a refill on the prescription if they haven't done their part to try to eat better and exercise.
All right, so it's just a lot of things you need to take into account when you're trying to lose weight. There's no magic pill. You have to do your diet. You have to do your exercise. So just taking care of yourself. And it's very important too that you guys are monitoring too, right?
When we're supervising, you've got a physician that's tried to keep you from having any side effects, and you've got someone to confer with if you have an unpleasant side effect.
Exactly. So when you're trying to lose weight, make sure that you do it the right way. Be very, very careful. Thank you so much for those tips. That was so helpful.
Thanks for having me.